Hello. I'm going to wait for a couple minutes for people to jump on, but welcome to our very first Helping You Help Yourself live on Facebook. I'm really excited that we could still do this, and if you aren't able to jump on the live, you can always watch the replay. Hopefully a lot of good information for you. Hold on, let me see if I can see the comments. Oh, hi Mo. Okay, perfect. Okay, well, I will go ahead and get started. Like I said, if you aren't able to watch the live, you can always watch the replay. Also, while we're going through, if you have any questions, feel free to post your questions in the comments, and I will get to them as soon as I can. If I can't see them, I'm not sure. If I can't see them, I will go back through after I'm finished with the video and answer all your questions. Okay, so we are going to talk about, hi Katie, we're going to talk about foot and ankle pain, hi Bree, and I'm going to talk about basically 5 of the main conditions that cause foot and ankle pain, and then I'm going to tell you some symptoms and some treatment options that might help you. So let's start with plantar fasciitis. So first thing, plantar fasciitis is probably the most common foot pain out there. A lot of people have this pain. So what it is you have a ligament called your plantar fascia that connects the toes to your heel. And when that ligament gets inflamed, it's called plantar fasciitis. And this can happen with overuse. So, let's say you're walking a lot, running a lot, just on your feet a lot. This can just become tight and it causes extreme pain. So the pain you're going to feel, hi everyone, the pain you're going to feel is on the bottom of your foot, right next to the heel, so very close to the heel. And usually this pain is going to be when you first wake up in the morning and when you're walking. So some things you can do for treatment. Obviously, one thing that you can do is ice at home. So icing is going to be very beneficial because basically the ligament is inflamed. So how you reduce that inflammation is with ice. So you would want to ice about 15 minutes. You could also, one of the best ways to ice is to use a frozen water bottle. And you can kind of just sit and put that water bottle under your foot and roll it. So that kind of actually stretches and reduces inflammation. So stretching is another thing that you want to do with plantar fasciitis because as it gets inflamed, it also gets tight. So stretching and reducing inflammation are going to be the biggest things at first. And then after that, you want to do some strengthening so that other muscles can support that foot. And that's kind of where the physical therapy would come in and helping you determine where you need to strengthen and where you need to stretch. Next one is strain versus sprain. So a lot of times these can get a little confusing. So I'm going to kind of describe the difference between the two. So a strain is an overstretch or tear of a muscle or tendon. So typically you're not going to see this in the ankle. And I'll talk about that more in a second. But the one you see in the ankle is the sprain. So a sprain is an overstretch or tear of a ligament. That's usually when you hear like, I sprained my ankle. It's usually a ligament that you've overstretched or torn, which would be in the ankle. Versus the first one, a strain of a muscle or a tendon is typically going to be a larger muscle. So like if you strain your hamstring, you'll hear that a lot. So talking about the ankle, it's mostly going to be sprains. It can be a little bit difficult though because a lot of times symptoms can be the same. So pain, swelling, bruising. But if it's the ankle again, it's probably a sprain. But you can always consult your doctor too if you're not sure. Ways that you can treat an ankle sprain would be resting, so getting off of it, icing, compressing, and elevating. So just elevating above the level of your heart. So laying down in a recliner, lifting your foot up, propping some pillows up, and getting that blood flow back to the heart so we can get that inflammation out of there. Okay. Next is bunions. So bunions are, I'm sure you've seen pictures, but bunion is basically a misalignment of the first metatarsal to your hallux longus. So hallux longus means big toe. So basically a bony bump forms on the medial portion of your foot, so basically at the base of your toe. And real quick, there was a handout posted right before this video on this page, so if you need a reference, you can always look back at that, and it has pictures on it to show you all of these. So symptoms are the bone deformity, pain, and stiffness. And then treatment options for bunions are wearing wider shoes. So a lot of times skinnier shoes can put pressure on that bony bump, causing more pain. Bunion pads are also an option to help just kind of cushion the bunion. And then a brace or a splint. So there's actually a brace or splint that you can wear, especially at night, that kind of pushes the toe kind of back where it's supposed to be, and that can kind of help realign things. And then if it's bad and you can't manage it with those things, there's possibility of having surgery to correct it. Next, number 4 is arthritis. So this is probably a common one that a lot of people have as well. So basically arthritis is inflammation of tissues around your joints. So any joint you can have arthritis. There's going to be pain, swelling, stiffness, reduced motion just because it's so painful and stiff. And eventually, if you don't manage your arthritis, you can actually end up causing joint damage that is irreversible. So if you have arthritis, you definitely want to take care of it before it gets to that point. Treatments include medication to keep the inflammation down, physical therapy and exercises. So with arthritis anywhere, you want to keep moving. So if you stop moving, those joints are just going to get stiffer and more painful. So you want to keep moving, keep exercising, keep working all those motions of the joint. And then once again, if it gets too bad, there is possible surgery for arthritis that you can kind of go in and remove some of that arthritis to help. And number 5 is a fracture. So a fracture is a partial or a complete break of a bone. So the ankle, talking about the ankle and the foot, the ankle is made up of 3 main bones, and the foot consists of 26 bones. So you can imagine that's a lot of bones that have a possibility of having fracture. And fractures can be caused by many different things. They can be caused by trauma, such as falling or car accident. Can be due to overuse, such as that would cause more like a stress fracture. So overuse could be like if you're a runner and you just run constantly, can kind of wear down and you can get a stress fracture from that. And then also disorders that cause weak bones, so like osteoporosis, just the bones are more brittle, and so definitely, with a fall, you have a higher risk of breaking a bone. Symptoms, obviously severe pain, I would imagine. I haven't broken a bone, but I imagine if you have, it's very painful. And you may also, because of the pain, you could experience loss of motion or function, swelling, and bruising in that area. So a lot of things with the ankle and foot, you can have swelling, inflammation, bruising. So that's why, it's important. Any of these things that I talked about can vary in how severe they are. So it's very important that you, consult your physician, consult your physical therapist, find out what really the underlying problem is, and go from there working on a plan of what you can do and what you need to do for your particular situation. Like I said, if you guys have any questions along the way, feel free to comment, or you can private message us and I can answer them that way too. Okay, so now that we've gone over those, I'm going to kind of show you some exercises. Obviously, so for the fracture, the last one we just talked about, normally, treatment for a fracture is going to be usually resetting the bone, especially if it's completely broken. They're going to have to reset it, bracing or casting to hold it there so it can heal, and then physical therapy afterwards to regain your function, motion, all of that. So with the fracture, you're probably going to get what's called a protocol from your doctor after your surgery, or bracing, whatever they need to do. So protocol is basically just your doctor giving you things that you're able to do each week out from surgery, and that's where physical therapy comes in and helping you determine what you should do and what you should wait to do, all that. So I'm not really going to give you exercises for that. If you have a fracture, definitely you need to consult with your doctor and come up with a plan for that. But I am going to share with you guys a couple exercises, just, even if you just have, nothing's wrong, you just have tightness or something like that causing some pain, I'll give you some exercises that anyone can do, and hopefully they will be beneficial for you. So I am going to move the camera just so you guys can see. So hold on. Okay, so hopefully you can hear me. So I'm going to start with, we kind of talked about plantar fasciitis. So I'm going to start with, this is a flex bar. So not something you probably have at home, but this is something that we use in the clinic. So it's just kind of has bumpy edges on it. And so what you would do with this is you would sit and you would have this under your foot. Let me take my shoe up here. So you would sit it on the ground, kind of roll. Sorry, I know you can't really see that. You kind of roll your foot on it. So if I was on the floor, you're kind of rolling it in that plantar fascia. If you want to do this at home, you can do like a tennis ball. Excuse me. Okay. Next thing you could do is use a towel. So this would be for strengthening the arch of your foot. So yes, we want to stretch it. Excuse me. But you also want to strengthen it. So this would be one where you would lay the towel on the floor, and then you would use your toes to scrunch the towel towards you. So this would be strengthening the arch of the foot. So stretching and strengthening of the arch. Next would be a calf stretch. So a lot of times with any ankle and foot pain, you're going to have some tightness in your calves. So how you would do that is find a chair or countertop. So you'd hold on to that stable surface. You're going to put one foot behind you and one foot in the front. So the leg behind you, the heel is going to stay on the ground, and your leg is going to stay straight. The front knee is going to bend, and you're going to hold on to your support. So you're going to feel that stretch in the back. Okay? Next one would be standing on one leg. So same thing, you would want that support. This is going to be for strengthening and stability of the ankle. So you would stand on one foot. So not your leg up here. You just want to relax it back. So you're just bending the knee, standing on one foot, holding on to something if you need it. But if you can go without, the goal is to stand on that leg for 30 seconds, and then you would switch. Okay, let me move you back up, just kind of for a few final things. Let me get a drink, sorry. Okay, like I said, if you have any questions, definitely go ahead and ask. Okay, so if you guys want any more information on those exercises, if you will private message us and comment with your email, we can send those to you, and you can have all the list of exercises and how to do them. And then, one other thing I wanted to mention is we are doing a new service that we just started this week called telehealth. So basically what that is you receiving therapy services at home virtually. And if you want more information on that, you can give us a call and we can give you more information on that. Let's see, I guess no questions. So yes, once again, if you view the replay of this video, comment questions on here and I will get back with you. But other than that, thank you so much for watching and tuning in to our very first live, and we will see you guys soon.